Hello team! Welcome to our video tutorial on how to perform a very basic ophtho encounter. As we all know, there is limited exposure to ophthalmology during medical school, but ophtho is a very hands-on specialty that takes a lot of practice to master. The goal of this short video is to give medical students some tools that can be useful when rotating with ophthalmology or to approach any eye issues seen in the ED, wards, or in outpatient clinics. Today we will focus on the components of a basic clinical encounter. Some learning objectives that we want to emphasize in today's video include recognizing key features of a good eye history, learning how to properly perform eye vitals, including visual acuity tests, pupil size and dilation, and eye pressure, understanding how to effectively participate in the eye care of patients as medical students, and developing systemic approaches to eye concerns in any setting. We will start with how to conduct a focused eye history. Most of the time, the patient will be referred to you from a general practitioner or the emergency department. The eye clinic can be super busy, so it is important to be efficient with our time while still being considerate of our patient's ophtho concerns. Therefore, it is important to develop a system that focuses on the patient's eye presentation. Instead of asking patients, "What brings you in today?" which can lead to multiple other conditions, try starting your encounter with, "Tell me what is wrong with your eyes today," or "What is going on with your eyes today?" After getting the initial history, kindly let the patient know that you will ask some focused questions to better address their concerns. Then you can ask about the patient's onset, duration, intensity, and quality of symptoms. Remember to ask what makes the pain better or worse. Check to see if their vision has been affected or if they have been having associated pain, itchiness, light sensitivity, or headaches. Ask about any recent trauma to the eye or changes in eye redness or discharge. And then finally, ask about any associated symptoms. Some important ophthalmology-focused questions include past ocular history, history of any eye conditions such as glaucoma or macular degeneration, history of eye diseases in the family, history of eye surgeries such as cataracts or lasers, any past medical history, most importantly systemic diseases such as diabetes, hypertension, or rheumatologic conditions, patient's medications or drops, and patient allergies.
Hi, Lynn. I'm one of the eye doctors. I heard you were having some eye issues. Do you mind telling me a little more about it?
Yeah, I had sudden onset pain in my left eye starting yesterday.
Ouch, that sounds terrible. Have you ever had anything like this before?
No.
And was there anything that you tried that had helped with it or made it worse in the meantime?
I haven't tried anything, no.
Okay. And then has the vision changed as well with the eye?
So it's a little blurry, but it's still okay.
Okay. So it sounds like you're having a little bit of blurry vision, but your biggest concern is the eye pain that started. Okay. Do you have any eye conditions or any eye diseases that you see an eye doctor for?
Not eye diseases, no.
Okay. Any eye drops that you take? Okay. And then do you have any diabetes or hypertension?
I have both.
Okay. And then any other medical conditions that you see a doctor for?
I don't.
Okay. Awesome. Well, we'll take a good look at your eyes and see if we can figure out what's going on.
Just like in medicine, we think about vitals. The eye has some too. Our vitals start with visual acuity. Today, we will use the Snellen chart near card, but long-distance wall charts are also common. For the near card, have the patient hold the card 14 inches away from them, or approximately half an arm's length away. It is very important for this exam to have good lighting to maximize patient accuracy. Make sure you always cover one eye. It is conventional to always start testing the right eye first, so ask the patient to cover their left eye. If the patient wears glasses, have them put their glasses on for the exam. If the patient wears glasses but forgot them, make sure to use the pinhole after initially checking vision. This is a quick way to correct for refractive issues. It is also sometimes easier to start in the 20/60 line and move forward if you suspect that the patient has good vision. As mentioned before, always document the right side first. If vision is improved with pinhole or patient wearing glasses, document this as VCC. Remember, documentation is very important.
Hold this card in the left hand, and then starting with the right eye, look through the hole, and then let's see what the smallest line you can read is. When you're doing the near card, it's important to have a lot of good lighting, especially in the hospital room. Sometimes that isn't great. And you can have them hold the card as near or as far away as they need to in order to read. And so can you read the bottom line here?
Yeah.
Having a pinhole occluder can be very helpful for checking a patient's vision. Of course, you can just check one eye at a time looking through the unobstructed hole. A lot of times patients need reading glasses or use glasses and don't have them with them. So the nice thing with the pinhole occluders is when you drop this little lever down that has the pinholes in it, it kind of acts as like a refractor.
And now the pupils. This is surprisingly one of the most challenging exams. To make things easier, remember to dim the lights and ask the patient to accommodate to a distant object, as this prevents pupillary constriction from near accommodation. Then, shine the light into each eye, looking first at the eye that you are testing and then at the other eye as well, in order to assess for both direct and consensual responses. Last, perform the swing light exam while looking at both pupils. This will look at relative afferent pupillary defect. This is completely different from testing direct and consensual responses, and we encourage you to use the link below for a detailed explanation about these two different exams and their significance.
Some things that can help when you're looking for an APD or just checking the pupils is have the patient pick a target across the room. Then why don't you go look at that green light on and off button, and then if you can lower the lights too, sometimes that can dilate the pupils a little bit more so you can get a better idea of how the pupils are reacting.
Lastly, we will go over checking eye pressure. While there are many ways to check pressure, one of the most common is the tonopen or the tonometer. Start by numbing the patient's eye with proparacaine 0.5% by placing one drop in each eye. To do so, we ask the patient to look upwards and place a small drop in the lower eyelid. Sometimes it is nice to give a heads up, as these drops may sting a little, but the sensation quickly passes. If the patient needs eye dilation for a later exam, you can give them dilating drops after the proparacaine has been given first. Common dilating drops that we use in the clinic is phenylephrine 2.5% and tropicamide 1%. These dilating drops last about 10 to 30 minutes, typically longer for darker eyes, and they'll wear off in about 6 hours.
Look up towards the ceiling. Okay. And same thing on the other eye. Awesome.
Then grab your tonopen pictured below, making sure to use a clean cover every time. And in a perpendicular angle, gently tap the tonotip to the cornea. The device will need about 10 measurements or produce 10 beeps before giving you a final read. Just continue to tap the cornea during this time. Remember to check both eyes and to document properly.
So you want to get these fresh caps, and then you just tear it open, and you put kind of the rubber sleeve onto the tip of the tonopen, and then you just hit the button to turn it on, and it'll show you 2 lines when it's ready to go. All right, Lynn, we're going to check your pressure. This is a tonopen. It has a soft tip, and your eyes are numb, so you shouldn't feel anything. But if it hits an eyelash, it tickles a lot. So do your best to keep your eyes as wide open as you can, okay? And go ahead and look across the room. Turn it on. Awesome. 21. Check the other side, look across the room.
You are now finished with your portion of the clinical encounter. Before you notify the attending physician, make sure you document your findings appropriately. Again, remember that the right eye is always first. Some other pearls that we want to highlight is to talk through your exam with your patients. They will appreciate knowing what is happening around them. If something looks off, always make sure to ask for help. And most importantly, you got this. We hope you consider a career in ophtho.
Do ophthalmology, go into ophthalmology.